Hello, everyone. I'm a family nurse practitioner student at Franklin University, Ohio, and today I'm presenting a conversation project about a patient that would talk about her wishes for the end of life care. The project is to help the patient to make her decisions about the end of the life care when the time comes. Patient I have selected is 58 years old female with a known history of congestive heart failure for the last 5 years, high blood pressure for the last 15 years, and diabetes type 2 for the last 10 years. And recently, within the last 5 months, patient was diagnosed with the cancer of vulva, for which she had surgery and she recovered fully from that. Patient came 4 weeks ago with a complaint of worsening bilateral leg edema for the last 6 months and shortness of breath on exertion with inability to perform her daily activities of living without getting fatigue. Patient continues to take her medications as prescribed with not much improvement, um, and the medications for the patient was also revised last visit, and a referral to a cardiologist was made. Patient was also referred to a oncologist radiologist for a consultation post surgery for her cancer. I choose this patient um, for the conversation project because I find patient wants to do many things in her life, before the end of the lifetime, and she's very positive about achieving her healthcare goals, and she wants to, with her edema of the legs, she wants to dance. She wants to be able to skate, go out with family, friends for picnics, watch movies, um, try different cultural food, and get together with a special long-time friend who have welcomed her to live with him in the house. Um, Patient is currently divorced and she has a daughter. Um, she has full capacity to make her own decisions about her healthcare plans. Um, and she today is here with her daughter to make that conversation with me. The goals for this patient treatment is to decrease edema of her lower extremities, improve her breathing, increase her exercise tolerance, and make sure she adheres to the plan for daily doing her daily weights, preferably weight loss, tight glycemic control for her diabetes, blood pressure control, low salt diet, fluid restrictions, adherence to medications, and was educated to call her healthcare provider if she experienced worsening of shortness of breath and weight gain of more than 2 pounds in a day, or more than 5 pounds in a week. Congestive heart failure is a chronic progressive disease with frequent exacerbations that sometimes require hospital admissions and much care frequently. Primary care health providers will also work with some interdisciplinary healthcare teams to revise the plan of care for her needs. Um, and We will make her plan, which will be more patient centered and patient preferred. Patient and her daughter came for the conversation to place a healthcare advance directive for her end of the life time, and she a patient has patient really wants her daughter to be her healthcare proxy because she thinks that she knows her better, and more than anybody else, and more so that she will carry out her wishes at the end of the life exactly the way she wants it for herself when she's able to make her decisions. Her daughter really supported her conversation, and she will do everything for her mother, and she wished for how to be taken care of at the end of her life. The discussion had no barriers or any challenges that were encountered, and everything was completed successfully with mutual agreement between the family and the healthcare provider. Family agreed also on patient to remain friend with the long-term friend that she wanted to without moving with him in the house, and patient agreed with the family decision and feels the same way. Patient had completed her advance directives and medical orders for life-sustaining treatment. In this advance directive, to emphasize, patient has chosen her daughter to be her healthcare proxy, and in the state of New York, actually, the living will is not considered a valid legal document as a part of advanced directive. Instead, they recommend to keep in place durable power of attorney or healthcare proxy document that is acceptable for healthcare and financial decision making. The copies of advance directives were provided to the healthcare provider and the family member, and the patient was instructed to keep a written statement declaring that she has an advance directive in place and where the document can be found. Patient understands that even after this advance directive is signed, patient can change her mind at any time. When new advance directive is signed, the old one needs to be destroyed. Patient's assessment was made for her decision-making capacity to actually place this advance directive, and the capacity was assessed by using a scale of competence to consent for treatment. Tools for the assessment actually included MacArthur Competence Assessment Tool for treatment, and this was based on a semi-structured interview that patient understands relevant information. Patient appreciates the situation and its consequences. Patient reasons well and communicates and express her choice. Um, Patient also had signed the medical orders for life-sustaining treatment, which is MOLST or POLST, and MOLST document was utilized in this medical orders for treatment. In this MOLST document, patient has clearly refused the CPR and intubation and have established a DNR and a DNI status. Patient has refused blood transfusions, dialysis, artificial nutrition, and implantable cardioverter defibrillator. Patient has although agreed on hydration, surgery, hospitalization, diagnostic testings, and medications if needed. Patient has also agreed on palliative care uh, to improve her symptoms of shortness of breath, pain, constipation, and in the end to really provide her comfort care. Patient is also willing to get admitted um, in a nursing rehab facility for acute rehabilitation, but not for long-term care. Patients wants to be at home at the end of the life with her family members. Um, the palliative performance scale was also used during this conversation, in case if the patient needs this kind of a care at the end of her life. Um, and the scale of the palliative performance came out to be 80% on the patient with full, based upon full ambulation, normal activity with some effort, um, and some evidence of disease. um, Self-care was full, normal intake, and the level of consciousness was also full. Another scale that was used as a performance scale was Karnofsky scale. The status on that was also 80% as the patient carry on normal activity with some effort and some signs of symptoms of the disease. Um, Once this advanced directive is in place, um, patient family member, especially her daughter, was relieved, and she thinks that it was something worth doing while she was able to make her decision um, um, on her and on the end of the life care. So, as a healthcare provider, I think it is very important to make patient understand that after completion of this advanced directive, there is increased possibility that patient's wishes at the end of her life care will be honored by her family members exactly how they want. Um, and that's the whole purpose and goal of educating our patients. At every visit, we see them, um, and it is important for both patients, healthcare provider, and the family member that how exactly will they get their care, what to get and what not to get at the end of the life care. Thank you and have a great evening.